This is a video of Dr. Annette Bosch, and you should absolutely give her a follow on YouTube. She did a podcast interview with Dr. Sean Baker, but here is a short video where she talks about ketosis. I learned a lot from this video.
Most people think they're winning because they jump to the advanced practices like fasting or carnivore. Isn't removing all the carbs the most advanced version of keto anyway? Actually, no. Many people who are carnivore or keto are actually only on step 1. I had Sean Baker on my show the other day, and we were chatting about his switch from carnivore to keto. Many people will think that's the same thing. It may sound confusing, but they're not. The carnivore diet is great, but it doesn't make you keto. The keto diet means there are ketones in circulation, and you can measure that to make sure you're there. If the one rule for the ketogenic diet is that ketones are in circulation, well, then the one rule for carnivore is to eat meat. Those are not the same. In recent weeks, Sean Baker was struggling with an injury, and he wanted to use an advanced state of ketosis to remove the inflammation from this injury and try and reverse the problem. His carnivore diet was not equating to ketones in circulation. He had to make some changes that would deliver this anti-inflammatory ketogenic diet. The Keto Continuum is a resource that I use to grade where the patient is along this continuum for making medical grade ketosis. When Sean Baker presented with this injury where he wanted advanced ketosis, he was not eating every 2 to 4 hours, so he was not in step 1. But many patients who come to the ketogenic lifestyle are still at this level. Step 1 is very common in America, but it's not how our ancestors ate. I kept this on the list so that there would be a place to start for most people that come and ask me, how do I use ketosis to reverse these medical problems? Step 2 is where the good stuff starts to happen. It's where folks lower their total carbohydrates to less than 20 per day. And for most folks, this does tip them into a wave of ketones in their body. Sean Baker was not at step 1 or step 2. He was further along the continuum than that. And his carnivore diet was really working for him. He wasn't using this for weight loss, and he was not using an advanced metabolism to reverse medical problems. But he needs it now. So as we advance to step 3, we look for folks to be fat adapted. And many people hop right into a carnivore diet or fasting without stopping here first. This is a trap that many carnivores fall into. They advance to fasting and high protein without adding the fat. This skips the fat adaptation, and their fat-based hormones like cortisol, testosterone, estrogen, or even vitamin D are not ready to live in this advanced state of metabolism. The second common mistake found on the carnivore diet is even if they're eating high fat, they're consuming food multiple times throughout the day. These multiple meals lead to a high insulin state because they come to the diet insulin resistant. The presence of ketones means you must reduce the amount of insulin your body is already making. And one way to do that is to eat fewer times and smaller meals. If they're eating that high-fat, high-protein carnivore diet multiple times throughout the day, those multiple meals prevent a state of ketosis because it stimulates insulin every time they eat. That insulin-resistant patient will not be in a state of ketosis. Sean Baker wanted to use the advanced state of ketosis to reverse this inflammatory injury. He ate multiple tomahawks per week. But in order for him to get into this advanced therapeutic state of ketosis, he needed to decrease the volume of food, narrow the eating window to a few hours per day, and then slide that eating window as close to sunrise as he could. The other steps of the Keto Continuum are doing just that. They're teaching people how to eat fewer times per day, decrease the volume of food, shorten that eating window, and then slide the eating window as close to sunrise as they can live with. This continuum has proven that if you want advanced ketosis, You not only have to do these things, but you have to, measure your ketones. Don't beat yourself up. If you're not as advanced as Sean Baker or as far along that continuum as you want to be, catch the mistakes that I made when I started.
So what I learned is that eating smaller meals, higher fat, of course, but fewer times per day, because otherwise your insulin will still secrete and keep you out of ketosis. And as she said, move the eating window earlier. And then also measure your ketones. Now I know that I've said, and Dr. Sean Baker and others have said, you don't need to measure your ketones. But if your goal is to be in ketosis for specific reasons, like Dr. Sean Baker is treating an injury and he wants to be in ketosis, you need to do that properly, and you can do it with keto strips or with keto meter, ketosis meter. I've never done that, and but this is a very interesting video and very, very helpful. And if your goal is absolute ketosis, this is the goal. And of course, this is very much applicable on what I talked about earlier about a very high fat carnivore diet. I'm talking about very high fat. And that is what Dr. Sean Baker is also experimenting with, especially if you want to get rid of inflammation, etc. Very, very interesting video.